But a lot of the people in my area don't have primary care physicians.
And that's another real
They
thing.
need physical therapy and can't get physical therapy prescriptions.
Yeah.
So for us, and then it's a crime for doctors to it's a just as big of a crime for a doctor to under medicate than it is to over medicate. And I think that Detroit has a bad rep on that because a lot of time doctors just come in this area and they're like, okay, we want to under medicate because we think that you have a high likelihood of being addicted to opioids. Well, that's true. But at the same time, you have to have a plan to be able to get these people what they need, but not make it to where they'll come out of it highly addicted to anything, you know? So I think that is the hardest part because so many people from Detroit have had that familial life or that history of drug abuse. And so but the way that they handle it's an opioid crisis and this and people just getting crimes for having, and so it's a whole conglomerate of issues that comes around this opioid thing. But a lot of major cities get hit in a negative way, I should say, because it's automatically looked down on because more people are probably getting addicted in the suburbs than they are out here. A lot of us are fighting addiction, so they're not trying to be addicted. Yeah. That's why a lot of them don't want to take their, they may be prescribed oxycodone. They like, I don't want to take it.
Yeah,
I can't do it.
Yeah,
my grandmother, I know 90, that was her.
My 90-year-old grandma broke her hip.
Yeah,
doing something she shouldn't have been doing.
Exactly.
And she was like, I'm not taking any.
Yeah.
And I'm like, wow.
Because they're scared of it. They're really.
Hip. I'm like, I can only imagine broken hip at 39, how that feels.
Oh my
broken
God.
hip at 90, I assume that gotta feel
it's terrible. I mean, these people are getting, they're so afraid of being addicted again that they're literally having hip replacements, no pain medication. They're literally having, a whole knee replaced.
Which kind of comes back to you. So you're getting some clients like this in the physical therapy, which means you kind of got to be more on your game because this person probably is not taking their pain medication, and they're probably not trying to really let out the pain they're in either.
Exactly.
So you got to be more keen.
Yeah, you do. Being the owner of a physical therapy clinic, because I am not the licensed care practitioner there, I do hire physical therapists, which eventually I want to get my doctorate in physical therapy, just to be able to have that under my belt. But they have to create a specific plan of care based on each person so that they could maximize your rehabilitation potential. Right? So you have the therapist that comes in and says, hey, based on this, they look at history, they look at this, and the likelihood of you being able to do these things. And so we have an extra level of care in physical therapy, right? Because for one, when you leave here, we want to see that you are well, or at least you are back to doing your activities of daily living. And that's the thing about physical therapy. A lot of times when you injure yourself, say you're in a car accident, a slip and fall, hurt on the job, whatever it may be, you are trying to rehabilitate yourself, maybe not back to full, total potential, but at least doing my activities of daily living. I could tie my shoe. I could do my hair. I could take out the trash. People don't realize that when you injure, these things are affected in a major, major way. And so that's why when people come to me, I try to help them get the benefits and the help that they need. Because of course, you're going to probably need transportation. And a lot of times they're like, oh, well, transportation, they still may drive. But if I'm injured, I want to drive as least as possible. I want to be in a car, in a driver's seat as the smallest amount of, you got to keep your head on a swivel when you're driving. Yeah. So, we also want to get them to seek medical benefits like housekeeping, attendant care. You don't a lot of people get into accidents and they're like, I'm good. Da, da, da. My aunt came to me one time after an accident and she had a concussion for 2 or 3 weeks. That could have been detrimental. Yeah. That could have been very bad. So a lot of times, my point of saying all that to say is that a lot of times, sometimes in Detroit, we minimize our pain or what we're going through just because we don't want to get back to that feeling of addiction or needing it, needing something. Feeling as though something else. And then, So I got to kind of convince people sometimes, this stuff is necessary. If you can get it.
I can see that.
Get it. If you can get a ride back and forth where I'm helping you in a car, I'm helping you get out. If you can get someone to come through and just clean your house. You know what I mean? You should want to get those things. If you know, a lot of people don't want to stop working. Fight for your lost wages. You know what I'm saying? Make them give you those lost wages. You getting paid up to 90, 80 to 90% of your pay. You need that. You know, take that little time off. But a lot of times we so perplexed for the dollar. We're so pressed to make our money and continue our same lives that we've been living. And later on down the line, it'll affect you. Later on down the line, you don't rehabilitate yourself after something like that. It'll always be an issue.
And I like where we're at, and I want you to expand on that a little bit. And so you'll see in the lower third. But Premier Care Physical Therapy, that is the business. We're talking to Corina Malone.
Yes.
But with that, as like back in high school, I snapped my knee, so I had a broke leg back in high school. But it was the right age. I mean, if it's ever a right age to break your knee, I'm a teenager.
Oh, yeah.
But with it, what I've learned, even now to this day, like they even said, like the screw in your knee, you may need to have come out. So it's like a slower walk or a bop. But our bodies and our minds are phenomenal, meaning like we can overcompensate. So like we'll have pain on one side, so now we're moving too much more on the other side, and now you end up with pain on both sides because I'm overcompensating for where your physical therapy didn't stand or you didn't,
or your gait changes, you know, the way you walk, your cadence, the way you stand, you know. So and people think that these things don't matter, but it's just like when if you have a cadence always to the right, imagine how much pressure you putting on that hip, that right hip. So I didn't even have a hip issue, but now I had a shoulder issue, and it's making me lean. It triggers all these other different things, you know. So for one, I think it's important that you, for one, seek the help and be okay with getting it. But that's why when they come to me, I try to do it in a different way. Like, hey, listen, I'm a partner. You know, you tell me what you need. You tell me what you feel like. A lot of times it's a lot of the things that I just named. And I'm like, well, they already have stuff in place to help you with that, you know? So I think it's kind of one of those things where, you know, you bring people to the water and you just trying to force them to drink, you know, because you want people to get these services. You want people to, like, if you get into an auto accident, if you don't go to physical therapy, 9 out of 10, you end up going to court. They're going to be like, ugh. You can't really be hurt if you didn't try to rehabilitate yourself and go to physical therapy. It really works, though. It really works. Premier Care, I've seen so many people. I mean, I've seen people come in there and break several things. I have a guy coming in tomorrow. His literally hand had fell off and had to get put back on. You know what I mean? Wow. So, you know, but it doesn't have to be like that for you to come to physical therapy, I think, is my main thing.
And therapy was able to heal, because that's the other thing. That as I believe, you know, they're saying we're discovering things in Western medicine, but I'm sure probably like people in Africa, in Asia have been doing this stuff for a long time.
Yeah, definitely.
It's just we're welcoming it into
Western medicine. Yep.
You know, because it was probably certain things where it just took more time.
Yeah,
you know?
It's just like the yoga practice. You know what I mean? That's what I thought about, right? I'm like, okay, so we rehabilitate. Yeah, that's cool. Do we have any more other services that we can rehabilitate them in other ways? So not just physically, but mentally, spiritually, you know, and psychologically. So I've been trying to partner with more or create more ways for us to rehabilitate, not only on that physical aspect of it. Because physically, you're just going to feel like I need pain medication.
Yeah.
And let me take it. I'll come to physical therapy maybe a couple times, you know, but I can't force them in. But if you change their mindset, if you change their lifestyle, if you change the way that they are moving and thinking about rehabilitating their own bodies, is better. So we try to do things like have mental health services. Like if you come into my clinic, you don't have insurance, I'll try to get you some. I don't know how, you know what I mean? Hopefully that's the white hat that I wear that, you know, just allows you to be able to have that opportunity. You know, a lot of people come in, they don't have it, they don't have a primary, they don't have the things they need to be able to do physical therapy. And it's sad. You know, it's sad to see that, for one, you don't have their insurance. For two, I'm like, do you have a primary care? They don't even know what it is. It's like, you know, so it's a lot of education going on at Premier Care. It's a lot of knowledge being shared, you know, and aesthetically, I looked in different communities, right? Because you go to Novi, I'm in Southfield a lot, and I noticed, wow, these physical therapy places are top tier. You know, these places where, you know, these people, the more affluent communities are going to rehabilitate, are hands down looking, you know, look way better than what it is. So in the Fitzgerald community, what I wanted to do is bring that same aesthetic value, that same cleanliness, attention to detail, I just wanted to bring that to the hood, I wanted to bring that to the hood. A lot of times growing up, I look at it now, we weren't offered these services, if we didn't have insurance, it's like whatever, if we didn't, go to, like I just didn't see beautiful places for us to rehabilitate. It's just like when you go in a mental health service. You shouldn't have to go in and feel like you're about to go crazy just from being in there. I think that we should offer, and we should make it very important, especially as Black people, to help our neighbors, to help our communities,